this set right. Get the lights right. Okay. So like I said, we are starting out with the obsessive compulsive disorders, which includes OCD itself, but there's also a couple of other disorders that are kind of classified in the same category. So all of these obsessive compulsive disorders are characterized by repetitive, intrusive thoughts. Those would be the obsessions. And then there's also behaviors that accompany those obsessions that kind of try to reduce the anxiety from them, and those would be the compulsions. So all of them will have that in common. The main difference is going to be the target of that obsession. And we'll talk a little bit, as usual, about some of the causes of this disorder. There's specific neurotransmitter systems in areas of the brain that seem to be involved. Treatment for all of these obsessive compulsive disorders is mostly resolved through therapy. There are some medications that can help a little bit with certain symptoms, but therapy is commonly the route that most people go for treatment with these. So like I said, obsessive compulsive disorder, we've got a few disorders here. There's three main ones. And again, I should also clarify, so all of these, there's either obsessions, compulsions, or both for each of these disorders in order to be diagnosed. So obsessions, like I said, those are thoughts. They're usually repetitive and intrusive, unwanted thoughts. Oftentimes things that are irrational, that don't make any sense, and they cause a lot of distress to the person who's suffering from the obsessive compulsive disorder. Those with the more general one, just general OCD, the obsessions they have can range. There's quite a few different things they could be obsessed with, but there are some common ones that come up pretty frequently. One of the most common ones has to do with like cleanliness and organization. So someone may have obsessive thoughts thinking that like their hands are really dirty or they're going to get sick. They may also worry frequently about like, leaving the oven on or leaving the doors unlocked or making those kinds of just like errors whenever they leave the house or try to leave the house. They may also have intrusive thoughts like imagining, violence or harm either to themselves or to other people. So they might have, sort of picturing like terrible, violent things happening to people. Those are other kind of common obsessions that come about. So then again, the idea is that they have these obsessive thoughts that they can't get rid of, and they often will have these compulsive behaviors that kind of help reduce the anxiety from those thoughts, at least for, a very temporary short amount of time. So the compulsions, yeah, go ahead.
Is vacuuming and carpet cleaning?
It could be. So if it gets to the point where it's, repetitive and intrusive, like whoever's doing it can't stop doing it because they feel like if they stop, it's going to cause some sort of terrible thing to happen, and it starts to interfere with daily life, then that would be OCD. But if someone just likes a clean carpet, that's probably not. So yeah, just like with all the other disorders, we got to figure out a threshold of like, does it cause distress? Does it interfere with daily life? Then that's where I would say it's probably treading into the territory of something that's diagnosable. Did you have something else?
OCD, like trauma.
Mm-hmm.
Trauma can cause you to have OCD, I think, because with me, like some terrible things happen, and I'm
Right.
constantly checking my doors and
Yes.
windows to make sure they're locked.
Yeah, that's entirely possible that there could be something that triggered a specific obsession and compulsion, and that's often the case, that it doesn't just come out of nowhere. There's some sort of history. Typically that history is going to be in childhood, but you could have something that happens later on that triggers it. But especially if you have, certain parenting styles, if you have a parent who's very obsessive about cleanliness, then that can kind of create at least a higher likelihood of that child then developing OCD, either as a child or later on. So yeah, often these can be triggered by trauma, by parenting issues, by all kinds of different things. And we'll probably talk more about that when we get into causes.
Okay.
But yeah, you're fine. Getting ahead of me a little bit, but that's always not a bad thing. So yeah, so they have to resolve these obsessions through their compulsive behavior. So they might, if their obsession is with cleanliness and they think their hands are dirty, they're probably going to wash their hands multiple times. And it wouldn't just be, obviously we should all wash our hands every time we use the bathroom, if you're going to cook or whatever, that's completely normal. But with someone with OCD, they're going to wash their hands, maybe 20 times in a row or something, really just a ridiculous number of times. And they feel this need that they have to do it, or else something terrible is going to happen. So, if they are obsessed with, worrying about windows and doors being locked, worrying about the oven being on, then they might have to check it over and over and over again. So if they are intending to go to work or school or go to the grocery store, they may end up being extremely late to those events or just miss them entirely because they have to go back 20 times to recheck the locks, recheck the oven, or whatever it is that they're worried about. So again, the idea here is that it's interfering with daily life to some extent. So that's general obsessive compulsive disorder. Again, with OCD, the idea is it's usually about general things. Someone may have multiple obsessions if they have OCD, so they might be obsessed with cleanliness and checking things. So it might not just be one thing. Body dysmorphia, you have a similar kind of set of symptoms, but they're all, as the name implies, kind of obsessed with body image. So someone with body dysmorphia, they typically are obsessed with a perceived flaw that they have in their physical appearance. So they might worry about, like blemishes on their skin or their weight or, various things. In order for it to be considered body dysmorphia, the flaw that they're obsessed with has to be essentially like not noticeable by other people. So if, for example, you had someone who has an actual, like maybe they were a burn victim or something like that, and they have, really bad scars on their face, that would not be considered body dysmorphia if they're kind of obsessive about that because it's an actual physical appearance that other people could see. So someone with body dysmorphia, they're obsessed with something that other people don't notice or care about or might not even be able to see as a problem. There's, again, sort of some common things that people tend to be obsessed about, and it sort of varies by gender. So women in general tend to be more obsessive about like their skin, their complexion, their weight, like size of breasts, facial hair, or hair in other like unwanted places. Men tend to be more focused on like musculature, trying to have large muscles. So those are the kinds of obsessions that they typically, are, depending on gender, are more common. And so they have obsessive thoughts about that, right? Just like with any of the OCD or obsessive compulsive disorders, they constantly worry and think about this perceived flaw, and so then they have compulsive behaviors to try to reduce that flaw. So they might compulsively wash their face multiple times to try to get rid of blemishes. They might, compulsively buy beauty products. At kind of the extreme end, some people with body dysmorphia may become obsessed with like plastic surgeries, and they may have multiple plastic surgeries to try to fix whatever this perceived flaw is that they have. And then the third one, hoarding disorder. So hoarding disorder is where people have obsessions and compulsions based around acquiring and keeping physical possessions. So someone with hoarding disorder, they persistently accumulate these items over a long period of time, and they kind of have obsessive thoughts about what bad things that could happen if they got rid of this thing. So if someone has hoarding disorder, often they will have, there's again kind of common things that they collect. So newspapers, magazines, things like boxes and bags, paperwork. Those are some of the common things that kind of people with hoarding disorder tend to accumulate. I see you making a face. I know for sure, like I have somewhere in a closet, I have a bunch of bags, right? Somewhere in a garage, I have a bunch of boxes I've kept. So if you have a little collection of some of those items, that does not mean you have hoarding disorder. Someone with hoarding disorder usually gets to the point where those items are cluttering all of their spaces. So it'll be in their living room, it'll be in their kitchen, it'll be in their bedroom. They don't have like a designated little area to kind of hide their little hoard of stuff. It takes over the entire house, eventually. And like I said, if they try to throw something away, or if someone tries to convince them to get rid of something, then that's when those obsessive thoughts often kick in, where they have these thoughts of all the just like horrible things that could happen if they get rid of this one item. And so then their compulsive behaviors are all around acquiring and keeping those items. One other thing I should say about this, one of the things that you might see, like if you looked in the DSM, is also a range of what's called insight. So insight is a person's ability to understand that they have a particular disorder, and every disorder has a different level of insight. So some people, if they have certain disorders, they're very aware that they have that. Other disorders, they might be less aware. And with the obsessive compulsive disorders, there's kind of a range. So you have some people who know, like, okay, I'm a hoarder, this is a problem, I need to do something about it. You have some people who know they have OCD and they need to do something about it. But in a lot of cases, people with these obsessive compulsive disorders have low insight, meaning they don't even realize that it's an issue. They don't realize that their behavior is abnormal in any way. So any questions so far about these 3 different obsessive compulsive disorders? All right, so epidemiology, obsessive compulsive disorders are pretty rare, compared to some of the other like anxiety and mood disorders we've talked about. So for OCD specifically, it's about 1.2% worldwide. Again, there's some gender differences even with the general OCD. So with general OCD, females are more likely to have the like cleaning obsessions, so cleanliness of themselves and also their environment and their spaces. And like we talked about with body dysmorphia, females more likely to be focused on things like breasts, weight, etc. Men with OCD are more likely to have like the intrusive, violent thoughts. So they may have OCDs that's more like obsessions about violence or other kind of like forbidden things. They might have intrusive like sexual thoughts, for example. And then for body dysmorphia, men are more likely to obsess about muscle and then also like hair thinning, so losing hair as they get older. But overall, 1.2% worldwide for OCD. It's kind of interesting. I saw this but didn't dig deep into why this happens, but it seems like with OCD, it's more common in boys in childhood, but then when you get to adulthood, that flips, so that by adulthood, it's more common in women than it is in men. Not really sure what is going on there, probably some sort of like societal factors, things like that. For hoarding disorder, there's kind of a wide range. So again, I'm not entirely sure what that is. I don't know if those numbers come from maybe like survey data, like asking people if they have hoarding disorder. And if that's a disorder with low insight, then you might get lots of people saying no, even though they actually do have it. So I would guess the 1.5%, that's maybe coming from like survey, whereas the 6% is coming from some different methodology of measuring the epidemiology. Hoarding disorder is much more common in adults over 65 than it is in younger adults. So, again, probably social factors there. You have someone who's older, they're maybe thinking more about like their legacy, passing things on to their children and their grandchildren. So they maybe, get a little bit more sentimental about keeping every little slip of paper because, those are treasured memories that they want to pass on to the next generation. Could also just be like physical limitations that's maybe harder for them to take the trash out or to take things out. All right, comorbidities. So OCD is often comorbid with anxiety disorders, ADHD, and tic disorder. So tic disorder is where someone has like, physical tics or even verbal tics. We haven't talked about that one yet. I don't know if we will. Body dysmorphia tends to be comorbid with major depressive disorder. And hoarding disorder tends to be comorbid with things like mood and anxiety disorders. Should also say that suicidality is somewhat high for these disorders as well, for obsessive compulsive disorders. All right, moving on to the cause of these disorders. So with, it's been a common thing throughout all the disorders, there's almost always some genetic component at least, and there seems to be a fairly strong genetic component for these obsessive compulsive disorders. So there's about an 85% overlap of diagnosis between identical twins. For fraternal twins, I think that number drops down to like 20%. So that suggests pretty strong genetic link here for all of these obsessive compulsive disorders. That's particularly true for any of these OCDs that have an onset before 17. So it's, if someone has it that early, then it's almost always a genetic cause that led to that. As far as like physical neurological causes, there's some evidence that there are disruptions of serotonin that lead to these obsessive compulsive disorders, and that was discovered somewhat by accident. Basically, there were patients who had depression and OCD, as a simultaneous diagnosis, and so they were getting like SSRIs for their depression. and then the clinicians noticed that they had reductions in their OCD symptoms as well. And that's only true if they're taking an antidepressant that targets serotonin specifically. So, we talked about a lot of different antidepressants. Some of them target norepinephrine, some of them target dopamine, but only the ones that target serotonin seem to reduce those OCD symptoms. So there must be something going on with serotonin that's leading to the obsessive compulsive disorders. And then as far as like the structures of the brain that are involved, there's a structure called the orbital-frontal cortex, which is kind of the front of your brain, like right above your eyes. And that part of the brain is really important for essentially it takes in all the sensory and emotional information that's coming in, and it analyzes that and then converts it to a behavioral response. And it does that by sending information to another structure called the caudate nucleus. So the OFC takes in all this information, sends it to the caudate nucleus, and the caudate nucleus kind of acts like a filter a little bit, so it'll inhibit some of those impulsive behaviors and make sure that you're only engaging in the behaviors you actually really want to, essentially. So it's been found that basically there's disruptions in that whole system, so people who have OCD disorders are not getting that filtering effectively, so their thoughts and their behaviors are much more compulsive and impulsive. They just kind of do whatever comes to mind without being able to stop that behavior or inhibit it. So those would be kind of the neurological causes. Cognitively, it seems like people who have OCD are overly sensitive to things like risk and harm, which makes a lot of sense, right? So they are constantly focused on what could go wrong if they left the oven on, if they don't wash their hands enough, if they have a pimple on their face, whatever. They're constantly worrying about the risks and the harms of things. And that may be due to conditioning. So that kind of goes back to what we were talking about with the causes. So if in your childhood, especially if you received lots of punishment for any of the things we've talked about, you're punished very strictly for making a mess. Your parents were very obsessive about your appearance and constantly made comments about flaws, then that could lead to body dysmorphia. So those kinds of associations that we form in childhood definitely contribute to these OCD disorders. The most common and effective treatment for obsessive compulsive disorders is exposure and response prevention. Which is kind of similar, when we talked about anxiety disorders and phobias, I talked about exposure, where you expose someone to whatever they're scared of in kind of an escalating fashion. So this is sort of similar. So you're basically trying to expose the person to not doing the behavior, right? So if you have someone who's obsessive about cleaning, for example, you might bring them into the therapist's office and maybe have them get their hands dirty. Maybe have them mess around in a potted plant or something so their hands are kind of dirty, and prevent them from cleaning their hands, and then kind of guide them through whatever anxiety or emotions come up because they now have dirty hands. Let's walk them through that. Let's talk about what thoughts and emotions are coming to mind, and then let's try to reroute those thoughts to be more positive, to be more rational, to be more quote-unquote normal, and then show them that sitting there with your hands dirty isn't causing any problems, the world didn't explode, you didn't get sick, nothing bad happened. And again, do that in kind of an escalating fashion. So you probably wouldn't start by putting their hands in the dirt, you might just have them imagine it, have them think about it, and then sort of escalate from there. So up to 86% of patients will have a positive response to that exposure and response prevention. I can't remember the time. I want to say it's like a 6-week sort of program is kind of the typical approach. It might be a little bit longer than that. I'm blanking on the number off the top. Something like 6 to 9 weeks is typically the kind of program that they do that has that sort of outcomes. Again, 86% response rate. Antidepressants, again, can be helpful. Already talked about that a little bit, how we know there's a little bit of disruption of serotonin. So giving specifically SSRIs or other antidepressants that target serotonin can help. But there's pretty good evidence that the antidepressants do not help more than therapy, and even combining them doesn't necessarily help more. So if you have the choice between taking the antidepressants and doing the therapy, it's probably a better route to go with the therapy, because then you don't have to worry about the side effects that come from medication. You don't have to worry about taking that forever. You can do the therapy, get better, and you might have to do some therapy again, right? Like you might have relapses and symptoms later on, but that typically you're going to have better outcomes from that than taking the antidepressants. Those therapies are particularly effective for the general OCD and for body dysmorphia. They're less effective for hoarding disorder. So hoarding disorder is one of the trickier ones to treat. Really the most effective way to help someone with hoarding disorder is to actually sit down with them and go through all of their items and talk through, why are you keeping this? What's going to happen if you throw it away? But as you can imagine, that would be extremely time consuming. If you have someone that has an entire house full of newspaper clippings and magazines and bags, etc., going through all of those items one by one could take weeks, months, forever. So it's very difficult to find a effective and efficient treatment for hoarding disorder. All right. Any questions about the obsessive compulsive disorders? Okay, we'll